Hi, I am Dr. Diana Londoño. I'm a board certified urologist in Los Angeles. And today we're going to talk about prostate biopsies. We're not going to get into why it was decided to get a prostate biopsy, but if your urologist decided you need a prostate biopsy, we're going to talk today about how to prepare, what to expect during and after. So let's get started. So the reasons to have a prostate biopsy are usually just a few. One is that you're concerned that prostate cancer could be present, so you need to diagnose it. Or if prostate cancer has already been diagnosed, but you are following it, meaning you're doing something called active surveillance, where it's not treated initially with surgery or radiation, but it is being followed and they need to reconfirm with a biopsy if it's the same aggressiveness or not. Also, if you had radiation for prostate cancer, at times, sometimes they can do a biopsy to confirm if there's a local recurrence of cancer. However, nowadays, there's very good scans, such as PSMA PET scans, that can be done to show if there's recurrence at the prostate, if it was radiated, or in other areas. But the main reason usually is because you're going to diagnose prostate cancer if you're concerned because of the PSA test or the rectal exam. And there'll be other videos talking about the prostate, PSA, and all that. But today we're saying you've already decided with your doctor a biopsy is needed. So let's talk about the biopsy. So how is this done? Well, this is done in the office. So there is no need to fast or stop your medications, unless we'll talk about them in a second, you're taking special medications to thin your blood or non-steroidal inflammatory drugs. So in that case, there'll be a special preparation for that. You can drive home and you don't need anybody to pick you up. Again, you can definitely drive home. How is the biopsy done? Well, it's usually done with the help of an ultrasound or in some cases with MRI. The ultrasound will help us to measure the prostate and also to look at areas that maybe we cannot feel, but we can see with the picture, and we can target those a little bit better with the ultrasound picture. If an MRI was done and the MRI picture showed that there was areas that were concerning, then you can do what's called an MRI fusion biopsy, using the MRI picture to fuse it, put it together, and really target those areas. So if you have decided that prostate biopsy is needed, let's talk about the risks. What are the risks of the biopsy? The main one is bleeding, infection, or that you cannot pee afterwards, called retention. So why are we doing it? Again, the reasons we talked about above. And now let's talk about how to prepare so we can minimize those risks. So as I said, the risk of bleeding is there, and that can happen no matter what you do or don't do to prepare. But it is essential that if you are taking any anti-inflammatory drug that is a non-steroidal, such as Advil, ibuprofen, or Motrin, that you stop those about a week before. This also includes aspirin, which a lot of people take every day for their heart. If you're on medications such as Eliquis or Xarelto or Coumadin, which thin your blood, they may need different timing on when to hold it. Some are less days, so it'll be 3 to 5 days. But again, it depends on your risk and what your primary care doctor, your cardiologist, or your urologist wants you to do. So please check in with them to ask when should you stop those. In very special cases, sometimes you can keep those medications, but again, it'll be with the guidance of your doctor. The other risk we talked about is infection. So it's important that the urine is checked to make sure there's no infection in the urine and that you take an antibiotic before your procedure. The length of the antibiotic taken or when you start it all depends on your urologist, so it could vary, but usually an antibiotic would be given before the biopsy and the night of, and also sometimes during the actual procedure right before. So that's going to help to minimize the risk of infection. In some cases, some people do something called the rectal swab, where they get a culture from the rectum and they get results to see if the antibiotic they would give you would be resistant, and they try to tailor and put the right one right before your procedure. So not everybody does that, but it could be done. The other risk is bleeding, infection, and retention. Retention means you cannot pee after the procedure. Usually it happens if your prostate is already large and you already have a lot of symptoms from large prostate, which could be difficulty peeing, frequency, urgency, or that the flow is weak. Many times you may already be on medications such as Flomax or finasteride or dutasteride to help you pee a little bit better. But regardless of the size or medications you may be taking, that can definitely happen. All these risks are low, less than 1%, but they can happen and you need to be aware of them before your procedure. Again, for the biopsy, to prepare, we got to make sure we stop those medications if you're taking them, such as any non-steroidal or anything that thins your blood. Make sure you take your antibiotic and that you come to the appointment regularly, meaning no fasting, taking all your other medications, especially for your sugar or for your blood pressure. Remember, you can drive home after the procedure. So now that you are there, what will you expect during the appointment? Well, it can vary, but many times, again, the urine is going to be checked right before to make sure that there's no infection, and they'll check to see how you're emptying your bladder to get a baseline to know where you were before the procedure in case there's problems afterwards where you can't pee. So it's always a good idea to know how well you're emptying before you start the procedure. The other thing that will happen is they will check all your medications, make sure again that you didn't take anything you were not supposed to, and they're gonna likely give you an antibiotic before in the form of an injection. Then the most difficult part of the procedure is just getting you into position, which usually is you're laying on your side with your knees bent up to your chest and you're facing away from the physician. Then they usually put some numbing jelly into your rectum, and then the ultrasound will go into your rectum. From there, they'll be able to measure and look at the prostate a lot better than just when they examine with their finger. So once that the numbing medicine is there and the ultrasound is there, usually they give you more numbing medication. This is with an injection, which you feel as a burning or tingling sensation or some slight discomfort. This is going to numb up the nerves around the prostate so that you should not feel anything after that. It is common to feel pressure or movement. We try to minimize this so you're not uncomfortable. But after this, you really should not have any more pain. If you're having pain, please ask your physician to give you more numbing medication. Once everything's all numbed up, what happens is that the urologist will measure your prostate and also look at any areas that, again, may look abnormal. Usually for us, it looks like a dark spot. You won't be able to see it, but we will be checking for those. Once, again, everything's numb, we've measured everything, then we proceed to get the samples or the biopsies. Usually it's 12 samples taken, but if your doctor felt something abnormal on the rectal exam, or if something was seen on the ultrasound while it was being measured, more samples will be taken from these areas. That's why the rectal exam is so important. Not only does it help us know the size, but also if we feel something, usually this is indicative of an area that may have prostate cancer. So we definitely take more samples there. The whole procedure will take about 5 minutes or so. The whole appointment likely will be about 30 minutes to get you prepared, get you in position, and make sure that you're doing well afterwards. Many times after the biopsy, your blood pressure will be checked to make sure your blood pressure is okay and that you were feeling okay. It's not uncommon that sometimes some patients may have a reaction called vasovagal. Vasovagal means that your blood pressure can drop, your heart rate, and you feel lightheaded. Usually goes away after you breathe a little bit, sit up, or also have some water or juice, but it can happen. It is not dangerous, but it can definitely be noted. Okay, so after the biopsy, what should you expect and what's normal or not normal? After your biopsy, what is normal is to have blood in the pee, blood in the stool for a couple of days. It should really start clearing up every day. And it's normal to have changes in the color of your ejaculation. That could be up to 2 months. So just be aware. It could be a variety of colors, such as rusty, pinkish, burgundy. It's all the same. It should really clear up. You may have mild discomfort, and if you do, just take Tylenol over the counter. You should not need any more pain medication after that. Again, make sure that you take your antibiotic, usually the night of your biopsy, and take all your other home medications. What to expect after the biopsy in terms of activity or things to do? Well, it's really important that you don't do any heavy lifting, you don't do any strenuous exercise, or any ejaculation for about 48 hours. Also be aware of bike riding because you're basically going to be sitting on the perineum, which is where the prostate lies. So take it easy for the next 2 days or so after your biopsy. Again, take all your home medications as prescribed, except for those medications that they asked you to hold. Usually you want to wait 1 to 2 days until there's no more blood seen, and then you can restart it safely. When should you call the doctor or be worried about something not going right? Well, if after the procedure you have a fever of 101 or greater, you have chills, then you need to call your physician because likely this is a sign of infection and you may need to have IV antibiotics and fluids. So call your doctor or go to the ER and let them know you just had a biopsy. If you have blood that won't stop, either from your urine or your stool, you also have to tell your physician or go to the emergency room. If the blood from the urine won't stop, it can form clots and it actually can cause you not to pee because it clogs. So it could be because of clots that you can't pee, or even if the urine is clear, sometimes you may not be able to pee. In that case, again, call your urologist, come back to the office, or after hours, go to the ER because if you cannot pee, a catheter will have to be placed to drain your bladder. If everything goes well, then usually in a week, you will have the results and you could discuss those at detail with your physician. Again, this is intended for educational purposes. Talk to your doctor about specific questions that are important to you and which will differ with everybody having different conditions. If you like this video, please share or subscribe to the channel, Diana Londoño MD, so we can make more content that can be helpful for you. Thanks again for watching All About Prostate Biopsies.